moved to Minnesota, then you would change your plan. Because all of the Advantage plans are filed by county by state, and all the supplements are all set up by state. But the supplements, if you ended up starting with that, they're portable. You can go anywhere in the United States and take the same plan with you if that's what you decide to do.
Question. You need to repeat, you said something to the fact, set up county by county?
The Medicare Advantage is option 2.
Okay,
Yeah.
so if I'm in Pierce County and I move to a different county in Wisconsin, then I have to change?
Potentially, yeah, that depends. Oftentimes the plans will cover many counties, so I don't know how close those counties are to each other. But so for example, when we look at the Advantage plan, we'll see that it might cover 6 counties. It could cover half the state. It
Gotcha.
depends on the plan.
Okay.
Yeah. Yeah, but definitely if you move from Wisconsin to Minnesota. Okay. All right, let's go to page 5. Moving along here. So we always have to pay our Part B premium. It's starting now at $148.50 in 2021, and we've heard it may go up about $10 in 2022. And that's something we always continue to pay. The Medicare Advantage plans cover all of original Medicare that we talked about, plus the extra benefits like vision, dental, hearing. They have to have everything that Medicare covers, plus more. If you're on, neither of you are on an employer plan, but if you were on a retiree plan and you were looking at an Advantage plan and comparing that to your company retiree plan, we would want to take a close look at that summary of benefits to make sure that you would be on the best plan if you were to change, because normally you cannot go back. There is a network of providers in the plans, in the Advantage plans, although with United Healthcare, although they have a set of networks, and for example, Lina is in the network, Mayo is not in the network, but you pay the same copay in or out of network for most of the medical costs or copays, but we'll look at that in more detail. For example, I could, on the plan that we're gonna look at, I could go to Mayo and pay $25 for a specialist anywhere, any Mayo, or I could go to an Alina and pay $25 for a specialist, say the same copay. And then if anybody had a lower income, we help folks get on extra help to reduce premiums and to save on your prescriptions. For a single person, that is about $19,000 a year or less. And then you qualify for extra help, and we can show you how to do it or sit with our computers and do that as well. If you don't get the Part D penalty, Tom, when you're within that window of your initial election period, you could end up with a Part D penalty, which is 1% of the average Part D premium, and that's every month, and that never goes away. We talked about the supplements filling in the gap of Medicare, and a supplement is not a Medicare Advantage plan. There is a difference between the two, which we talked about. Okay, now let's go to page 6. And this is some basic Medicare education that we have to go over for you. So all the prescription plans, whether it's built into the Advantage plan or it's a separate standalone, all have to follow these federal guidelines, okay? So there's 4 stages. There's the annual deductible. So some of the carriers will charge a deductible first, and you pay that until you reach the deductible. You pay for your medication. It varies by plan. Then there's the initial coverage. This is where you pay a copay or co-insurance. Could be $0 for a prescription. It could be $47 for a prescription, depending upon which one you are on. Once you hit the total cost of that prescription equals $4,430, then you would go into the coverage gap. And that's the total cost, what you pay and what the carrier pays. When you're in the coverage gap, you pay 25% of your prescriptions, and then the equation changes, so it's your total out-of-pocket cost of $7,050 in 2022. And once you hit that total out-of-pocket cost, what you pay and the discounts you might get from drug manufacturers, then you're in the catastrophic stage where you pay $395 copay for brand name or generic, or $995 for other drugs, or 5%, whichever is more. So let's go to page 7. Page 7 talks about some of the guidelines that all the carriers have to follow. So there is a pharmacy network. Anywhere in the United States, United Healthcare has about 65,000 different places where you can get your prescriptions. CVS, Walmart, Walgreens, all the national brands. The formulary, every carrier has a formulary or list of prescriptions, and they take that list of prescriptions and they put them in tiers 1 through 5. And those tiers 1 through 5 would vary by cost. Tier 1 is a lower cost. Tier 5, your specialty drugs, are a higher cost.
Can I ask a question on that, please?
Sure.
Or would you rather I wait till the end?
That's fine.
Okay. So does each carrier have their own formulary?
They do.
So one drug could be covered in tier 1 with this company, but another company could be two or three.
Absolutely.
All right.
I'm glad you asked that question, because we always look up your prescriptions and find out what tier those prescriptions are, because we want to make sure you're paying the lowest cost on those prescriptions.
Okay.
Yeah.
Thank you.
And that's exactly right. We see that often, where it'll be tier 2 with one carrier and tier 3 with another. It's usually the difference of tier 2 and 3 that we see substantial changes or differences.
We're between 2 and 3?
Yeah, tiers 2 and 3, yeah.
Thank
Yeah.
you.
And then the step therapy, you may be asked to start with a lower cost prescription before you start with a higher cost prescription, and that's to keep your costs down. You want to keep these costs down as much as possible. If you're taking an opioid type of prescription, there are quantity limits. You might be limited to 30 per month, for example. And then there's prior authorization. So if your doctor wants you to take a certain type of prescription, they may need to ask for a prior authorization to cover that medical condition. And then there is an exception. If it's not on the formulary, you can get an exception, and your doctor will take care of that. And in most cases, you can get exceptions. I've seen them come through in most situations. Because I didn't tell you this, but I used to work for United Healthcare for a long time. So I've seen some exceptions come through. So that makes me even more proud to represent them, in these meetings. But it usually takes about 72 hours. So those are some of the Medicare types of things that we have to cover. On the back of this book, you're going to see, you can jot down your prescriptions, jot down your doctors. That's what we're here for. We all have our computers with us. We can look them up to make sure that your primary is in the network. Not that it would matter in terms of payment, but we want to put that on the application, and then look up your drugs. Exactly what you're saying. We want to make sure that you have the lowest cost prescription. And you cannot enroll yet, but we can get you ready to enroll by October 15th, okay? All right, next let's go through the shopping sheet, or side-by-side comparison sheet, this big one. So, as you can see, across the top are the 4 different products that United Healthcare offers. And down the side are the benefits, all right? There's one plan that's not on here that we use oftentimes for people that are on Extra Help for $34.90 premium. But let's go through these 4 to give you a sense of what they're like. I'm just gonna go high level, and then we're going to go into more depth on the plan that's $99 a month. So as you can see, there's 4 different plans, and these are preferred provider organizations, meaning you don't need a referral, and you can go, and with United Healthcare, you can go anywhere in the United States that takes Medicare. So the monthly plan premium on the Riverbank is $99, their Lakeshore is $49, their Headwaters is a 0 premium, and the Patriot plan is a 0 premium. That Patriot plan is the plan that we use primarily for people who are veterans, who are using their VA for their benefits, and this fills in some extra benefits for them as you can see, like the extra glasses, the dental, because they oftentimes don't get dental at the VA, and ambulance, they don't get ambulance at the VA. So going down the side, the annual deductible, there is no medical annual deductible. The primary care visit is $0 for all plans except for the Patriot plan. So that means you can see your primary doctor with a $0 copay. Then the specialist visits are a little bit different. So you'll see a tier 1 and tier 2. That's not prescriptions that we just talked about. What that means, that tier 1 is M Health Fairview. M Health Fairview, you get a discount for going to M Health Fairview.